Yes, it's strong enough to remove body tattoos, but gentle enough to remove the eye tattoos, right? The ingredients that are in this because we're not a saline removal and because we're not a acid or alkaline, this doesn't do damage to the eyes. So we're not dehydrating cells. We are not creating damage and destroying cells. We're actually initiating the cells to do a better job and to repair better. So we are able to go in and remove the tattoos from eyes as well as around the lip line and lip tissue. These are advanced techniques that we do recommend, that you have several removals underneath your belt, really understand the removal process and getting a good result before being able to move on to lips or eyes, just due to the delicate tissue. We want to make sure that we are giving our clients the best possible results. The best possible results means you need to have your A game put on. So that being said, we've talked about a little bit about body placement, the depth, where it's going to be. Let's talk about expectations, realistic expectations, and talking to your client. And I'm going to hand it over to Leah Richardson over from the UK.
Hi, everybody. I'm just going to talk briefly about client management and client expectations. So I'm going to cover a few points here. They really obviously do make sense for removal, but a lot of these will apply to all of the treatments that you offer anyway. So the first point that I say that we need to cover is establishing the client's desired results and why they're looking for that removal in the first place. So we need to think about why they want that removal. Are they just coming to us because they're panicking because their friends told them they're too dark or they're slightly wonky and they're not willing to wait 4 to 6 weeks? Or are they coming to us for that emergency removal? We need to identify the reason behind that. If someone's brows, for example, look like we would expect our clients to look like, and they're just having a little bit of a panic, they're still waiting for their second treatment and then might need a little bit of symmetry added, and we want to be sending them away and obviously reassuring them that that's what to expect. But we are going to come across cases, myself recently, where I had a woman message me having a bit of a panic because her brows realistically were twice the thickness that they should have been tattooed, and we had to go ahead and do that emergency removal as soon as possible. So we need to know the reason behind why in the first place. We also need to know what their desired result is and figuring out whether that is realistic or not. So are they just wanting to fade the brows a little bit or fade a tattoo a little bit so it can be reworked or covered, or have they had an ex's name tattooed that they just want to completely disappear? So we need to understand what result they want at the end of it as well. The second part, and all these kind of points do tend to kind of blend together anyway, but the second point that I say is transparency. Be honest, but be professional. So you're going to have cases that come to you for maybe a brow top-up, for example, and they're just booking in, they just want a brow top-up and it's somebody else's work, and they don't really see anything wrong with it, they just want a little top-up of the colour. At this point, we need to be completely transparent with our clients. We need to understand that we can't just put pigment on top of pigment on top of pigment on oversaturated brows, and we need to be able to explain to them in a professional way that they are going to need some removal in the area. The reason I do make a point of saying in a professional way is because me personally, and I know you guys are the same, you don't want to go and slam everyone else's work. You don't want to be bad-mouthing the technician around the corner. Yeah, if the work's not to a good enough quality, we say that, but we do say it in a professional way. The third point that I've gone with is set realistic expectations, and this really is the most important point regardless of what treatment you're doing, but especially for tattoo removal. I always say you're better to undersell and over-deliver than end up with a disappointed client. It's the same thing as I say with like brows or lips or any treatment that you're doing. If you think that a brow removal literally might take you 1 treatment, which is very realistic with Xtract, and we can get those brows out in 1, sometimes 2 treatments. If you think it's going to take you that 1 to 2 treatment, you're still going to advise your client that it's going to be maybe 2 to 3, 2 to 4 treatments. You don't want to be promising things, because we all know that the bodies do heal slightly differently, and it depends upon the client and how they look after their treatments as well. So you don't want to be promising them things and giving them these expectations where they might be a little bit disappointed afterwards. The great thing with Xtract is I'm yet to have a client who's not been amazed by their first result, if I'm being completely honest. Another point that I've said is establish regular communication. Especially with the removals, we encourage that, especially on the first treatment. You want to be in regular communication with your client, and you really want to make them feel comfortable enough to be able to message you if they have got a problem, or if they're wondering why something's doing something, or if they're struggling with a little dressing or something like that. You want a really open flow of communication with your clients. I'm not saying obviously be best friends with everyone and have everyone on Facebook, but you do want them to feel comfortable enough to ask you a question and not feel embarrassed by not knowing the answer already. I put always document, so sign contracts and take photographs. Obviously, we all know we should all be doing this regardless. This is for insurance purposes. We do need to do this to cover ourselves for insurance, but another reason that I really encourage people to do this is because it's amazing how much clients don't see a difference when they see it every single day. But if you show a client a picture 6 weeks after it's healed to their before picture, so they're normally absolutely blown away because they're seeing it every single day. They almost don't realize how much of a difference there actually is. So always document for insurance purposes 100%, but even just to show your client that timeline and the improvement on the treatment. And the last one that I've put, which hopefully we don't have to do often, is turn down clients if you need to. You're not obliged to take on every single client that comes through your door. We do have the right to refuse, and if you have a funny feeling about a client, or you don't believe they're going to look after their treatment the right way, the correct way, sometimes there's little telltale signs, like you'll be talking to them and explaining things and they'll try finishing your sentence or something like that. You don't want to be taking those clients on, even for permanent makeup or any other treatment. You don't want to be taking on a client that makes you feel uncomfortable in your own environment. So yeah, if you've got any more questions on anything that I've just covered, please write them in the comments, and we're going to do a little Q&A at the end if there is any questions to answer. But I'm going to pass you over to Julian now.
Hi, everybody. Thanks, Leah. Very nice. Okay, so what I'm going to discuss as far as, when we have a new client coming into the office, usually they come in for a correction. Sometimes they don't know if they need a removal or not. So my whole thing is, why is removal needed? Okay, so as Leah said before, it's very important. I have my notes here, so I'm going to look. You have to lift the saturated pigment out of the skin. The skin is like a sponge, right? It can only handle so much foreign matter like pigment or anything in the skin for so long. You need to remove it in order to put something new in. And as Leah said before, if you're going to do a correction over a shape that has old pigment in it, especially even if it's really deep pigment, over time, your work is not going to last in the skin, so it's going to require more touch-ups. The more touch-ups we do, the more scar tissue is possible, inside the eyebrows or wherever the PMU needs to be done. So you can have too much scar tissue, and in addition to that, you're just living on pigment on top of pigment on top of pigment. And then also, additionally to that, especially if the PMU is really old, say 5+ years old, pigments have really gotten better in their technology and ingredients over the last 5 years. So if we're implanting pigment, or if we're removing pigment that is 5 years old, we don't know what kind of pigment is in there. We don't know where that pigment or ink came from. We don't know what country. We don't know what kind of allergens are in it. Okay, so getting into allergies too. So I've actually seen cases where artists or techs have done touch-ups on top of old pigment, and then Leah, as you've also had a case study, they developed an allergy because of the old pigment, because we're disturbing that old pigment as we're implanting more pigment on, so then we can have an allergic reaction, which is not pretty at all. Okay, so, in the past, now Xtract can remove allergic pigment allergens, where in the past, allergies could only be removed by excision. Nobody wants that. Terrible. Okay, so that's very important. Okay, so if we attempt to, right, I discussed that one already. Discuss the touch-ups. Okay. This is another big one, is shape. Okay, so as this industry got better and better and more very talented artists entered the industry, now we're seeing really beautiful shapes. So if you're an adept artist who knows how to like totally customize a shape for a client's face, it's not cookie cutter, but something that looks completely natural, you're not going to want to go over and do a touch up over a shape that maybe is not so nice for the client's face. Okay. So that's another thing. And I will not work on a client that I cannot put a good shape on. I just won't. I'll turn the client away. Either she has to get removal with me, or I have to turn her away to maybe go get worked on by somebody else. It's just something, it's something very important in my business. So when you walk out of my office and you're on the street, your brows have to look stunning. So, you know, I've actually done that before. I've done so many removals that I've gotten the shape down to a workable shape that I can actually put something really nice on my client after a shape that she wasn't so happy with. So that's really important. And what else did I need to say? Yeah, that's pretty much it as to why removal is needed. I mean, most important thing, number one, is really the allergens. And then I've seen also recent posts on Facebook where the pigment is way too deep. You can literally see the skin has like a translucent sort of white, and it's not the titanium dioxide. It's because that pigment was put so deep, and you see the gray underneath. So in this case, you're never going to have a really good result unless you get at that pigment and remove it. That's just the way it is. So, okay, I've said my piece. Are we doing Q&A now, or does anybody else have something to say?
I think we kind of covered everything there. I just wanted to say about obviously what you were talking about then. You couldn't be more right about having to turn people away. That's the incredible thing, obviously, about removal. As artists now, we can offer that service and we don't have to send them elsewhere. But I think as an artist, similar to you, who won't touch other people's work unless I know I can make an improvement on it, Xtract has been a lifesaver for me, because as I said in the previous videos, and Erika has as well, and yourself, I've been trained in other removal methods before, which I wasn't quite getting the results that I wanted out of it. And a massive majority of my work is covering other people's work. It is. There's so many clients that come through my door, whether they've told me that they have previous work or not, are there with brows that have already been done, or lips, or whatever else. So I couldn't agree with that anymore. And with the allergens as well, 100%. I think it's common, but it's also because our industry is becoming more saturated, and there is people that try to cut corners. Like you say, there's older inks that are in the body which are now getting mixed with newer inks, and we can trigger chemical reactions or underlying reactions or anything in there. So I always say, if we're going to put it in, we should know how to take it out.
Yeah. Totally. And I'm actually to the point now where I work very, very lightly in the skin. And my techniques are very translucent. I use a 1 point needle. I don't drill in the pigment. I use a very light, feathery touch. Yeah. And now, like with the organic pigments and new pigment lines, they actually stay better. So you don't have to drill in as much pigment. So the less pigment I have to work over, the better my work is going to look. And I've actually had some a negative experience before where I've gone over somebody else's work, and the work still came back with not so great results. And within 3 months, the artist was like, I'm not the artist, the client was like, I need removal now, which is understandable. So now at this point, I'm not even going to work on skin unless the pigment is removed 75%. I need it mostly clean in order for me to do that.
Okay, so
at the end of the day, we're just adding to the problem. If we keep building up layers and layers and layers in the skin, they're going to need removal eventually anyway if it's an already saturated brow. So we're basically just delaying the inevitable.
Yes, for sure. I 100% agree. We're going to answer a few questions, everybody. So one of the questions was, is it a case where the sooner the better you can remove a tattoo, or does it work well on older tattoos? Yes, it does work well on older tattoos as well, but I do find that the sooner you can get to somebody, just because that pigment has not completely settled in with the macrophages, that I think that it is slightly easier to go ahead and remove it. The body responds well, and you can get a really good healed result. Yes, we remove tattoos that are 20-something years old. I think that's the oldest one I've done is over 20 years. of age that I've done. Oh, maybe actually I take that back. With permanent makeup, it was 30-something years for brows, and it was a little bit harder to remove, I will say that. And that's because it was so deep down, it was in her subcutaneous layer. So, and that's the reason why it would be take a little bit longer to remove. But no, it is effective on older tattoos as well. One of the other questions was on the size. The largest size that could be done is a 3x3 at a time. And that's because we are using the immune system to be able to remove this. So that is important to know. You can, if you have a larger tattoo, you can break it down into sections. So you can do a 3x3. By the way, the 3x3 is inches, not centimeters. That's really important. Yeah. So that's larger than centimeters. So 3x3 inches that you can remove at a time. And if you're working on a larger section, you can just take it in a 3x3. 3 weeks later, you can go back in and do another 3x3. So you can take it out in sections to be able to move back and forth. The other question was the
sorry,
color.
can I just
pop
into that? With your 3x3, just be aware that obviously that is it's the overall surface area of 3x3. So if you've got a longer but very, very thin tattoo, it's the overall surface area of that. So for example, along the side of your foot, if it's kind of half a centimeter long but half centimeter high, but 15 centimeters long, that would still class. We could still work that full area.
So that would be like 9 square inches.
Yeah.
So, okay, so color, yes. Xtract works well on all colors. There is no color. It's agnostic. It doesn't see one, but there are colors that are a little bit harder to remove in the skin overall. One is titanium, and one is the orange or the reds from iron oxides, and which do look that orangey color. They will come out. You will see removal with them every time. But in experience, we find that those are the last colors to remove from the skin. So you'll see a huge lift on all the other colors first, and then that will be the last ones.
I've noticed that generally you colours that have got your smaller particles are going to lift a lot quicker. The iron oxides, titanium dioxide, they actually have the largest particle size, especially titanium dioxide. So naturally it is just going to take a little bit longer to break that down. But as Erika said, we do get it out of the skin.
Yeah, which is nice because a lot of people, most of the pigments nowadays are using carbon-based.
Okay. There's another question. Do they scab heavily? Do you guys want to take that, or do you want me to take it?
You can take it.
Okay. Okay, so yes, the healing process for Xtract is a wet healing process. So they don't actually scab. What they do is we keep the serum on it, the aftercare serum, which is very important because the aftercare serum, it's actually a patent pending technology called zinc finger technology, and it actually continues to chelate and pull the ink out during the healing process. And this lasts for 21 days. So not only is the pigment coming out during the initial process, it's actually still coming out throughout the 21-day ink chelation process. So we don't form a scab because the scab itself is going to stop that pigment from continuing to come out. We leave it open, so then there's no barrier between the ink still coming out and the surface of the skin. And as Leah said in the last webinar, I think she said that she actually, when you removed the bandage, the ink was actually an exact mirror replica of the tattoo.
Yes.
I need to find that photo so we can post it. It was literally a mirror image.
Yeah, and I just want to jump in on that. So it is, the repair serum is actually patented. So this is a patented product. The 1,3-beta-glucan is actually patent pending, but the repair serum is patented. So just to
it's really cool actually how the healing process works. As Julie was saying, we're not allowing that big scab to form on top. You actually see the new skin building. You see it with your eyes day by day. You see that fresh pink skin building, and then obviously the pinkness kind of settles down. But it's really interesting to watch it kind of almost close from the underneath up instead of closing off and then letting it build.
Yes. So you're preserving all the growth factors, which is why one of the reasons why that we do the moist healing. Studies show that it heals 2 to 3 times faster with moist healing. And as Julia was saying, it preserves all the growth factors, all the cells are able to freely move, the ink continues to purge. So there's multiple benefits of moist wound healing, which is very important in this process.
Do we have any other questions, guys?
One of the questions, let's see, because there are only 3, let's see, suggestions for effective follow-up when physical distance is an issue. Are you referring, well, currently, right, I mean, the best answer is, are you talking about I'm guessing you're talking about weeks after, Jenny? So that would be just really trying to teach your client to take good pictures and to be able to, which of course is light is coming from in front and on the side, making sure the camera does not block it. If you can get somebody else to take the picture, that's going to be your best thing, because you can't really get a really good clear picture and tap on it at the same time to be able to zoom in and get a clear, concise. But hopefully all of this will be over fairly quickly and we'll be able to follow up with all of our clients. I hope that answered that. Let's see, is there any, let's see, let me look.
Oops, we lost you.
I don't know why I can't see the questions, guys, for some reason. They stopped ages ago and I've not had any more updated, so I can't. Oh, you're on mute, Erika.
Sorry. Okay, one of the questions, sorry about that. One of the questions is it different from saline removal? 100%. This is not a saline removal method. Saline removal method works by means of osmosis. Osmosis is where you're basically dehydrating the cell to make it spit everything else out of it. Okay, it can be used very effectively for different things, but with this process, we don't want to cause damage to the cells. We're wanting to make sure that we are helping the cells. We're working with the cells. So this is different from any other removal method. All other removal methods do damage to the cells. Our removal method does not. We work with the cells and with the body to be able to release the ink and to be able to carry it away. So 100% it is different. I do recommend that if you did not see last week's webinar, to go back and watch that, because it does kind of talk a little bit about that, on what we're different and the different ingredients that we have and what makes us different from all other removal methods.
There's one that's saying about migration for the eyeliner here. So we were actually talking about this just recently, weren't we, in the group? So with migration, it's naturally going to be a harder removal because obviously this is focused on eyeliner. And the reason that eyeliner migrates more often than other body parts is obviously because the skin is much, much thinner there. So you're hitting the deeper layers a lot easier. So we can remove it, but it is a more difficult removal. We have to set more of a realistic timeline, and we can't guarantee a full removal from there. It is very similar, although probably slightly more concentrated as it's more pigment in there, but to post laser, and when we're trying to get rid of that shadowing, all those particles again are so deep because they've been blasted into tiny little particles, and obviously the body's drawn it deeper and deeper. So we can remove from areas that are deeper, but it does take a lot more work, and we can't guarantee it to a client, basically. So
what are the questions? Oh no, I think that was good. I know we're trying to wrap up because it's been 30 minutes. There isn't really a number of times that we can work on a area for removal. I have worked 7 times on somebody before. Usually I don't have to do that. Usually it's between 1 and 3 times that I'm removing a tattoo. Body tattoos, generally 4 to 6 times that you need to remove. Yeah. But really it just depends on the person, where it is in the skin, and how well the person's body heals. So
There's one that says, can this be used in conjunction with laser? Yeah, absolutely. Tina touched on this on the previous video, so I would definitely recommend going and watching the first webinar that we did last week. It's been posted on all of the socials, so you'll be able to catch that. But just quickly, absolutely, it can be used in conjunction with laser. It's really good to kind of do a final clear up of all those cells, particles, sorry, which laser can't identify anymore because the particles are too small. But yeah, absolutely, it can be. Do definitely go and watch that video with Tina though, because she does go into it a little bit more.
And then there are some questions about the training. We do have the training. We did talk a lot about that last week. Leah went over that. So I definitely recommend going back and watching that webinar as well. For the training, we do have online and in-person training. We think that is very important, and we discussed that. And then, of course, the question for when you can remove it, we kind of touched on that. But yes, at any time straight after, a year later, 2 weeks later, 10 days, 1 day, 3 days, it doesn't matter. Sooner the better you can get in would be better. So I think that answers most of the questions.
Yeah, I think so. Let's have a look. I managed to find the Q&A section. So finally, I was like, I'm looking at the chat and no one's questions are coming up here. I got it. Yeah, that's all I can see on my side, but if there's any more that you guys have got.
Okay. Yes, you can always message us, direct message us, email us, however you would like to do it. So we will definitely be coming back next week and discussing some more things. So stay tuned, or be ready to look out for our webinar link so that way you can join us. So thank you so much, everybody.
Yeah. Same time next week. Okay.
Yes, same day, same time. Yes, so whatever time it is now today that we started, put it on your calendar for next week.
3 p.m. Eastern time, 3 p.m. And
8 p.m. UK.
Thanks, Erika. Thanks, Leah.
No, thank y'all so much. Y'all have a wonderful day. Stay safe, everybody.
Thank you. Take care, everyone. Bye.
Bye.